On the Scene coverage of ACC 2015 is supported by Effient.
I'm Peter Block in San Diego at ACC 2015 for On the Scene. On my left is Rajiv Pathak, who is from Adelaide in Australia, and he is doing some fascinating things with, of all things, weight loss and atrial fibrillation. I mean, if you told me that that's going to work, I would have said, really? So tell me about what you're looking at here, and tell me what you're finding, Rajiv.
So we're looking at the long-term impact of weight loss on atrial fibrillation, freedom from symptoms, as well as the hardcore freedom we see from 7 days Holter. So the findings, really salient findings of the study was weight loss had a dose-dependent effect on atrial fibrillation.
Okay, so let me interrupt because, I mean, when you say atrial fibrillation, these are patients in AF to start with,
Yes,
who are overweight.
of course.
Is that the way you started?
So the study is basically a report from our registry of 1,415 AF patients. We found 825 of them had a BMI more than 27. Of those patients, when we excluded someone with permanent atrial fibrillation or who had AV node ablation or had any serious medical condition, 355 patients remained. These patients all underwent structured, physician-led, dedicated weight loss management. And to look at the dose-response effect, we then divided patients into those who successfully lost more than 10% weight versus those who lost 3 to 9% versus less than 3%. And we have looked at those results and what effect these different weight loss has on the cardiometabolic profile, on the AF symptom burden, as well as the total AF freedom seen on 7 days Holter.
Okay, so you say AF symptom burden. I'm not quite sure what that means. So tell me about that and tell me how many of these folks went back into sinus rhythm.
So to assess the AF symptom burden, we normally use AFSS questionnaire, which is a Toronto-based questionnaire which looks at 3 aspects of AF. So AF frequency, duration, and symptom severity, and also captures the global well-being of these patients because of AF. And we found weight loss has a dose-dependent effect. So they had, with increasing weight loss, there was a stepwise decrease in AF frequency, their symptom burden, and their AF total duration. With a stepwise improvement in their global well-being score, they felt much better with being free from AF. And when we,
let's go ahead.
So when we looked at their 7 days Holter, the most striking finding is with the more than 10% weight loss, 46% of the patient at 5 years were free from atrial fibrillation without an ablation, without an antiarrhythmic drug.
All right, so I have to ask this question. This is craziness, right? So how does this work?
Yeah. So weight loss, any of the cardiac risk factors, we know cardiac risk factors are associated with atrial fibrillation. These risk factors cause structural remodeling, electrical remodeling leading to AF. So management of these risk factors, we have shown that the weight loss or blood pressure management has effect on the metabolic profile, on the structural remodeling of the heart. So especially in this study, we found weight loss had beneficial effect on metabolic profile. So systolic blood pressure got better, the lipid profile got better, the diabetes and glycemic control got better. They had beneficial effect on structural remodeling with the LA volume went down, the ventricular septal thickness went down. So all these important effect on the cardiac structure, we think has led to the reduction in AF burden.
That's an amazing report. And, I think one of the things that we're challenged with in cardiology is this whole business of how many patients are overweight and what that does to them in multiple areas. This is a perfect example of how weight loss will change the cardiometabolic parameters that lead to atrial fibrillation.
Yep.
Thank you so much for being here.
Thank you very much.